To learn more about this season's flu bug and if the UConn Health Center is seeing more patients as well, Dr. Runjhun Misra, a primary care physician, is here to talk about this year's flu. So we just heard that Hartford Hospital has seen a big increase in flu cases. Is the case the same at UConn?
The cases are the same. We're seeing a statewide increase compared to last year. And the CDC has numbers, and basically 157 cases were reported, 34 of which were the actual seasonal flu, which is H3N2. So we have to be careful because the numbers are rising, and CDC is saying, you know, be careful because the flu season might be prolonged.
Now, we are hearing some of the reports that people who got the flu shot are actually still getting the flu.
Well, so the thing with that is there's a 2-week period between when you actually get the shot and when it becomes fully active. So you want to make sure that you're still doing everything in that 2-week period to take care of being clean, washing your hands, you know, being away from sick people, and if you're sick, staying at home.
Taking all those precautions.
Exactly.
Now, if you don't have a flu shot yet and you're interested in getting one, if you're not feeling quite right, should you hold off? Say if you're feeling a little bit maybe under the weather, then should you wait until you're 100% back healthy and then get the flu shot?
You don't necessarily need to wait. Usually we say if you're very, very sick or you have a very high fever to kind of hold back and get the flu shot when you're better. But if you're feeling just a little bit under the weather, it should be fine.
Are you seeing more cases in kids or adults? Or
it's kind of widespread, but there are risk factors. There are age groups that have more of a risk of getting sick and having more complications. Kids under the age of 5 are a group. Adults over the age of 65 are also a group. And then, you know, if you have other medical problems that complicate things further, you're also at a greater risk.
Now, let's talk about the symptoms, because a lot of people think that if you have the flu, you have to basically be feeling nauseous and be throwing up. But that's not necessarily the case.
Not necessarily.
You could have the flu and just think you have a really bad cold or head cold, right?
Right. And the thing with the flu is it's so hard to tell from just a common cold. It's so difficult. So that's why a lot of people don't know whether they should go to the ER or stay at home. Now, you mentioned the vomiting, you mentioned the flu, and kids actually have more GI or stomach symptoms with the flu, not as much adults. And I always tell my patients, if you think this is not the common cold and something is very off, so you're feeling a lot worse than you usually do, you have a bigger headache, you have a higher fever, you just can't get out of bed, then you should be concerned, and that's when you should be going into the hospital.
Now, you said it is kind of tough when to know to go to the doctor, when to know to go to the hospital. So what's a trigger that you can sort of take into account and know, like, all right, this is it. This is more than just a cold.
Well, you know your body best. I always tell my patients that. So they know everyone's had the common cold one, or more times in their life. If you don't think that this is the common cold, you think something else is going on, and you have any doubt, you should call your doctor and discuss the symptoms with them. If you feel that you're just, feeling terrible and you might die, you need to go to the ED. But
if you think that this is killing you, it's probably the flu.
But the important thing to remember is that when you go to the hospital and you're not that sick, you might actually contract it from someone who has it there. That's why it's important to think about how sick are you really.
Right, it's really kind of a catch-22.
Exactly.
So if you think it is the flu, but like you just said, you're not really sure if you want to go into the ER because you could come into contact with even more germs, are there some things that you could get over the counter to take care of it?
There isn't really anything you can take over the counter per se. The two medications that they give should you have the flu and you're very sick, one of them is Tamiflu, is actually not over the counter. It's a prescription only drug, but that's talking about if you have the flu. If you don't have the flu and you're just feeling under the weather, it's the normal stuff. Drink lots of water, get lots of rest, wash your hands, keep away from people.
And pretty much just kind of, I guess, ride it out, right?
Exactly. Take care of the symptoms.
And on the UConn Health Center's website, they have a lot of information.
They do.
You can sort of assess where you're at and if you should, in fact, go to the ER.
Yes, definitely. They do.
Doctor, thanks so much for being with us.
Thank you so much.
Very helpful advice.